Good morning to Dr. Aradhana. I welcome you all, especially Dr. Aradhana, our today's guest speaker. So this webinar is being organized under Institutional Development Plan GADVASU, which is being sponsored by ICR and New Delhi. Our today's distinguished speaker, Dr. Aradhana, is our proud alumnus of our institute. She did her graduation in 2000, and then she completed her MBSc in epidemiology and preventive medicine. She then moved to Australia, University of Sydney, and held various research positions there. Then she moved to USA and did residency in Louisiana University and completed her licensing examination over there. And she is triple board certified in anatomic and clinical pathology, and also in American Board of Toxicology. She has attained more than 10 years experience in pathology, clinical practice, and toxicology. And she worked as director pathology at Boehringer, which is a very renowned company. And she has been instrumental in drug safety and assessment and drug development. Currently, she is holding position as scientific director of pathology at Moderna. So we have chosen this topic for the webinar from her domain, blood smear review. I hope this will benefit our graduating veterinarians or the practicing veterinarians uh, in GADVASU as well as and other institutes who has joined this webinar. So if you have any questions regarding this webinar, you can post at the chat box. Later on, we can discuss the questions. So over to you, Aradhana, please.
Yeah, thank you, Dheeraj, for the
Uh,
introduction.
uh,
Yeah, hello everyone. Thanks for the opportunity. Do you hear me well, okay, Dheeraj?
yeah,
Okay,
perfectly.
okay. So, well, first of all, I will say good evening to you. Mine is good morning. Here it's about 7:30 in the morning, Monday, and happy Guru Purav to you all. Um, Yeah, so the topic of today is blood smear review, and then everything you would like to know. Well, I lied. 1 hour or 40, 50 minutes is not enough, but the point is, or the effort is to give you a guidance and then show the importance of the blood smear review, which takes about a couple of minutes to prepare a smear, a drop of blood, and then you can get so much out of it, and then obviously diagnosis as well, or some pointers for you to that will help you towards the diagnosis and eventually the treatment of the patient. So thanks for the introduction, Dheeraj. And so I'm just going to reiterate. I put together this. Actually, I really like it. So obviously, you guys are good Vasu, but when I finished my veterinary degree from Punjab, it was PAU. We were part of the Punjab Agriculture University. So you can see the PAU and then Gadwasu right now in this Google Map. And after these golden years of bachelor's and master's in the veterinary medicine, we flew to Australia, Sydney, University of Sydney. Uh, where my husband was doing PhD, he's a veterinarian as well. But I was in different research positions for a period of 3 years or so. And then we decided to move to the US, and then we went to the Oklahoma State University. And at Oklahoma, back then, There was a clinical year program that you could do, being a foreign graduate, what's called ECFVG, and then you can, and then I also did the clinical proficiency exam, all the stuff you have to do to practice veterinary medicine in the US. So I did that a year in the Oklahoma, and then I went to Florida, Jacksonville, Florida, in the clinical practice. I was there for the small animal medicine clinical practice, obviously after doing all the licensing requirements and so forth. I did not stay in the clinical practice that long. Then I decided to move to back to academia, and then what we did, and my husband did as well, we did residency in pathology. We went to Louisiana State University. This is in the south of the US. So we stayed most of the part south of the US, or southeast right now. So at LSU, I did clinical pathology residency. So for the pathology residency, it's a 3-year residency, and you have to be a veterinarian. That's a requirement. So after 3 years of residency, and then we did, when I say we, my husband and I, we did boards, that is diplomate in American College of Veterinary Pathologists. So we were boarded pathologists. And then we moved to then Kansas State University. So then we moved to the Midwest, where we were faculty, a pathology faculty at the veterinary school there. Then I did, my husband moved to Georgia, so it's in Southeast, and then I did another boards because it was a little difficult to find job there, so I was just more for the survival strategy. I did anatomic boards while he was at the university, and then so then I worked at the animal health. This is a pharmaceutical company, Mariel. I don't know if you know or not. Boehringer Ingelheim, for 8 years or so, and then just actually not even a month ago, I moved to, as Dheeraj said, to a new company, Moderna, in Cambridge, Massachusetts. So I don't know if you, just to give you a perspective, Moderna is one of the few companies where one of the few companies where the COVID vaccine is coming. Actually, it's in big news these days. Obviously, I didn't do much. I just joined the company, but just to give you a perspective. Okay. So Dheeraj, do you see my presentation screen?
Yes,
Okay.
it's visible.
Okay. All right. So I think I see a question for the DVM in Australia. Is it same as Canada or America? I think it's yes and no back then. I will just quickly answer it because we already 10 minutes in. I don't know how you want to proceed towards the end.
Yeah. We'll take these questions later on.
Exactly. Okay, so let's go through the presentation, and Mehak, I will answer your question towards the end. Okay. All right. So this is who I am, and even so, I can give you, even if we won't be able to answer any question related to the topic or any questions you have, please reach out to me. I'm happy to help whichever way I can. Okay, so let's go back to the topic. So before you prepare, look at the blood smear, you have to prepare it. You need to know what to look for and how to look for. If you don't know how to look at, you don't know what to look for, right? So we will go through each of this. We will have a systematic approach. So there are 3 cell lines, basic RBCs, the red blood cells, WBC, the white blood cells, and platelets. These are the 3 cell lines you look at for in a blood smear. Obviously, you look at the different things in each cell line, and then we will just give a touch to the non-mammalian, like birds and stuff, because they are very different than what we usually see in our dogs and cats and large animals. when I say large animal like horses or cattle and so forth. So just to give you a perspective of the non-mammalian blood smear as well. So let's see. So first of all, blood smear preparation. So obviously you need a blood sample, and the best, the anticoagulant or preferred anticoagulant is AGTA. And then, which is what we call purple top. You can also use heparin, but this is the preferred. Why? Because idea is to, when you make a blood smear and you look under the microscope, the cell morphology or the how cells look are preserved in this anticoagulant than any other anticoagulant. Um, so then the question is, how much blood do you need to put in or fill in the tube? Is a drop, 10 drops, an ml? So the very basic thing is like half of the tube. Why? Because a tube has EDTA anticoagulant, so you want the proportion of the blood and the anticoagulant to be enough so that one or the other is not more. Because if you have more of the anticoagulant, meaning the less blood in the tube, then it can impact your red blood cells. It can shrink, and then when you look under the microscope, it's difficult to look at the shapes and then make anything out of it. And then, okay, so when you make for example, you are in the clinic and it's a Saturday or Friday, then it will be closed over the weekend. Then what would you do with the blood sample, right? So you cannot process it right away. So some of the do's and don'ts that you can refrigerate overnight or you can ship with the ice pack. And then the best thing is to prepare at least a slide or two as soon as you can, because more the cells stay in the ADTA or any anticoagulant, it can impact the morphology when you look under the microscope. You do not refrigerate the blood films because it can again impact the way you look at the cells. And the second thing, for example, you are at the what do you call, the postmortem or the necropsy. You have a animal and then you're collecting the tissues, for example liver or something, and then you are putting in the formalin, and then you have another animal which you are going to euthanize, and then you are collecting blood before euthanasia, and you happen to be close by. The point is you do not expose your blood films to the formalin. Why? I will show you just in a second. So for example, this is what you're doing. You're making a blood smear with a drop of blood. All it takes a drop of blood. So that's the point. With the drop of blood, you can get so much information. You get another slide, spread the drop of the blood, and then just spread it out. And then the point is to have this what we call feathered edge. This is a thicker part of the smear. This is a feather edge. This is not the best area to look at. So this is what we call where the cells are very spread out, what we call the viewing window. So you have this blood smear and you happen to have a tissue for some reason by this blood smear in the formalin, and then with the formalin fumes, the exposure to that, it changes. See the change of the color, and compare this, which is formalin exposed to the regular. And then when you look into the microscopes, the cells are all distorted, and then they are not able to, you're not able to make any interpretation out of it. So what I want you to learn is keep your blood smears or any smear that you're making from a mass or anything that you want to look under that you want to stain and then look under the microscope, keep them away from the formalin. Okay, so there are many right stains, the good stains that you can do if you have a well-established lab, like the stainer, like right Giemsa is the most commonly used, that you use stainer and then it can stain about 10-12 minutes. But if you're out in the clinic, this is the best thing you can do. what you just need what we call diff quick stain. And then you need a fixative, the first one, which is mostly a methanol that you want to fix your cells. You dip for a minute or so, and then when the cells are fixed, then you put in what we call pink stain or eosin. And then this is just to color the RNA of the cells. And then the last one is the blue stain. So this is a diff quick stain that will stain your smear. And then you dip for a minute or minute each in each, and then you're ready. So it just take about 2 or 3 minutes from preparation to stain a blood smear. Okay. So now you have a blood smear. What do you do with that? But you do need a microscope to look at the blood smear. So before you look at the blood smear, as I said, you need to know how to look at the blood smear, right? So I told you there is a viewing window, the where you put the drop is too thick, but there are something you need to look for in that thicker area. The edge is also not the best area for the cell morphology, but there are few things you need to look for in that feather edge as well. So now you put your slide under the microscope, and then few of the things it's like a bird's eye view. Okay, so you look at the platelet clumps. I will show you just in a second a photo of that, a clot. And then you also look at, so see, I told you there are the 3 cell lines you need to estimate at the bird's eye view. Very low mag, vary from very maybe 2x or 4x, whichever you have. How much RBCs, are they kind of connected together? Are they sparse? And I will show you why one or the other is important. And then your leukocytes, meaning white blood cells, and that neutrophils and other cells, how the feel of it, how many there are, because if there is an inflammation, you would expect to see more. If this is a neoplasm or for example, leukemia, you will see a plenty of them. So I will show you an example of that. So this first step is just to have a feel of it and subjective estimate what is going on. And note that you will have a CBC or hematology that the machine will run and give you numbers that you have with you if you are in a clinic. For example, if you are at GADVASU, you will have that information. But if you are out in the clinic, think about that. You may have this blood smear quick way for you to get to some point. Okay, what's going on with this dog or a cat or a camel? I need to know so that I can move to the next step of the treatment. Okay. All right. So let's make, I told you, right, when you make a blood smear, you push things. So what do you push? You push the bigger things out on the edge. What are the bigger things? It could be bigger cells, like neoplastic cells are big if they are blastic cells. You also push the platelet clumps, and you also push a parasite like a heartworm, like microfilaria. So the point I want you to remember is the feathered edge, the edge of the smear. You just quickly look at, are there bigger things I need to pay attention to? Okay. Okay, so this is how the platelet clumps look like. They are, so just let's quickly review the 3 cell lines. So these, the red ones, the pink ones, these, you see my arrow, Dheeraj. Can you confirm quickly, please?
Yes, we can.
Okay, excellent. Okay, so these are the red blood cells, and these nucleated cell are this is a neutrophil, so this is one of the white blood cell. And these cells, like pinkish granular cells, these are platelets. Okay, so this is a platelet clump. So why it is important to note if there are platelet clumps, because when you run this sample through your machine to get, for analysis, you might see lower platelets. Okay, so is this animal has true lower platelets, or because the platelets are clumped and machine could not count it. Okay, so that's why it's more of the confirmatory that, okay, the number, it's a count is lower on the CBC. I don't know what you call it, hematology analysis, and this is why, because most of the platelets are clumped together. Okay. And another example, so this is, can you see, this is more of the edge of the smear. So all of the platelets are clumped together. There's another smaller clump over here. Okay, and there are a few in the background over here as well, and then again red blood cells. This is an example of a clot. And think about that, so you had a drop of blood. So this is, we are looking under that smear made from a drop of blood. And you can see if a drop of blood can have a clump or a platelet, rest of the, remember you collected half of the tube. So there's a likely chance there are more in there. And there's a likely chance your machine is going to tell you that the platelets are slightly lower. Okay, so this is more of the confirmatory, or to make, to see if the platelet counts are actually lower or because of the clumps. Another big things, as I told you, are the parasites. This is on the feathered edge. These are microfilaria of the heartworm. Heartworm disease is very common in dogs, and then it's a cycle of 6-7 months that the male and female parasites, when they reach to the L4 stage, they get to these microfilaria stage, which you can see in the blood smear, and this is transmitted by the mosquitoes. So this is microfilaria. Okay, another thing I want you to know is that, so this is just a cartoon of red blood cells. So whenever, obviously, when you get a patient, let's say a dog in the clinic, obviously you're seeing that dog or a cat because they're sick, right? And there's a likely chance they are going to be dehydrated. They have not eaten or drank any water for a period of time. So very likely these patients are sick, they are dehydrated, and if there is something going on, likely there is inflammation as well. So what these conditions do, that because of the inflammation, the globulin, the protein, is a positive acute phase protein, and it goes up, what we call hyperglobulinemia. That means you have a high protein circulating as a part of the, or as a reaction to the inflammation. And another inflammatory protein is fibrinogen. So you have that increased as well. So this is hyperfibrinogemia. So what these do, these leads to stacking of the, it's like a coin stacking of the RBCs. So this is just a cartoon, but these coin stacking in the RBCs. And this photo looks different because this is more of the, you put a drop of blood, a drop of blood, and then you do not stain it, and then you look under the microscope with the refraction. And then if you put, so you can do the dispersion test just to see if this is real kind of sticking together, or this is because of the protein, they are sticking together. So if this is because of there's what we call ruler formation, they should separate with the addition of saline, and then you can add more saline to see. So these are dispersed, right? So these were stacking up, but these are dispersed. I will tell you in a second why this is important. So this is, okay, so this is stacking because, they were dehydrated. So let's think about that. The cells are sticking because there's less plasma, or there's high protein. So why this is important? Because the opposite of stacking is also what we call agglutination. So this is again the cartoon of RBCs. The cells stick together, but now see, this sticking together is different than the coin stacking that showed you, right? So this one, the what we call agglutination, and then even if you put drops of saline, it would not go away. You know, you put a drop of saline, it may separate a cell or so, but still they stick together. Why? Because the antibodies against these RBCs are sticking them together, and this is mostly you will see in the immune mediated diseases where the antibodies are causing them to stick together compared to the previous example, right? So that's why the saline dispersion test sometimes is important for you to know that this is a real agglutination, which is different than the rouleau. And this agglutination is the reason why this animal could be anemic. And then there's the immune mediated response, or the disease or the condition is going on. Another big, so first remember at the bird's eye level or the bird's eye view, where from very low mag, we look for the platelet clumps, for the platelet clot, for RBC, how they are arranged or sticking together. So, and then third cell type was leukocytes. So these are the white blood cells, these nucleated cells, okay? So, and I told you that you estimate, like have a feel of it, how much they are increased, decreased, or normal in number, right? So I just put a 20x down there for that we are at 20x mag. So what do we think about leukocyte density? They are in, I don't think we can have a back and forth interaction. But my question was going to you was, just tell yourself, do you think these white blood cell the number of white cells look okay to you, or increased or decreased to you? So answer yourself, but we will move on. So we do estimate how we do it. I mean, I usually don't do it anymore, but I just have a feel of it. But there is a formula at 20x that you count the number of leukocytes, like 1, 2, 3, 4, and then so forth. So there are about 25 white blood cells, and then you can multiply the number of cells you count at 20x, multiply with 500, and then it's about 12,500 cells. So in this case, yes, leukocyte density is slightly increased, not overly increased, but slightly increased. Okay, what do we think about this one? Okay, talk to yourself. So I would say, you know, they are fewer than the last photo, but way fewer than the last photo. So decreased leukocyte density. And but pay attention, they could be, it could be that they are pushed on the edge, feathered edge. So when you have a feel on the viewing window, they are decreased. Go back and look at the feathered edge. They are not, it's not like everybody's going to the edge. Okay, so just confirm that. What do we think about this one? I just see a leukocyte in this big window. So obviously I think they are markedly decreased. So then you start putting the, what we call severity. So one is decreased. I can tell that. How severely decreased? Okay, you know, I see it's like nobody's in the house. Okay, so 1. Okay, so let's see. Okay, so now we are going down, and the higher magnification, maybe 50x you have. Then we will start with the RBC, and then we will go to the next cells. So red blood cell evaluation, what do you do with that? All right. One thing I want you to know, and this is very important. So in the and all of these photos I showed you, red blood cells are nice pink discs, right, with no nucleus. But when they come from the bone marrow, they are nucleated. So this cell is a blastic erythroblast. It's a cell, and this purple is a nucleus, and then there are the rubriblast, and then all those stages that bone marrow spits out. And this is what we see. So remember, this is what we were seeing in the photos before. So this is what we have in our circulation, red blood cells, but they are coming from the bone marrow after these stages. And then when they become this, what we call reticulocyte, they spit out or exclude the nucleus to become this RBC. And RBC is the only cell in the body which does not have a nucleus. But when they are formed in the bone marrow, obviously they do. So why this is important? Because when you look at the blood smear, so see, you do not see any nucleus because these are red blood cells. So this is the stage you are seeing, the what we call mature RBCs. So what we have in the circulation are the mature RBCs. When we say we, our patients as well, dogs, cats, or whoever, um, have these mature red blood cells. If there's anemia, I'm anemic, my bone marrow is going to be in action and it's going to spit out more of in an effort to make more red blood cell because I'm anemic. So it's going to send more the little bit immature stages of the RBC, what we call, as I said, reticulocytes or polychromatophils. So you will see more of these. So these are on the arrowheads are more bigger, bluer cells. And if I'm very anemic and my bone marrow is doing so much action, so it's going to spit more of the immature in that effort, and you will get to see few of the nucleated red blood cells as well. Okay, makes sense. But if you have a bone marrow smear, you get to see all of these stages because this is where this is happening, the action is happening. Okay, so the point is, when you look at the red blood cells, so now we are looking at only the red blood cells. You look at, okay, do I have immature, but so remember the cartoon I showed you just in a previous slide? So it said they're disc shaped. I mean, in this 2D under the microscope, they look round, but in a way they're disc shaped. It's like a donut. They have a depression in the middle. But when they're immature, they are bluer and bigger. So yeah. Okay, so just this is a photo of that. So these are immature. The disc shape. The disc is short, is being seen as a hollow in the middle. And then on the arrowheads are the bluer and bigger reticulocytes. And then I want you to look at spherocytes. So, okay, so look at the difference. So just pay attention to this. These are mature RBC, bigger, with a, disc shaped. And then these ones are what we call spherocytes. So what is the meaning of spherocyte? What happens is when there is so for example, my immune system is acting against my red blood cells. So those immune system or they pinch off a part of the RBC and pinch it off. And then it leaves behind a smaller red blood cell, which is more sphere. And that's why it's called spherocytes. So whenever we see these spherocytes in the blood, it's very classic of immune-mediated hemolytic anemia. But you have to be very cautious to look at that viewing window, because more you go out towards the edge, because of the pushing mechanical action, when we make the blood smear, the red blood cells, they appear to look more rounder. Okay, so one very diagnostic of IMHA or immune-mediated hemolytic anemia, but be cautious to not overcall. So be in the window where you can see the mature red blood cells and others, and they're not distorted, and then you can see these ones. Okay, another one. So what do you see in this one? So we see agglutination. Remember, we looked at agglutination, where the cells are sticking together, but it was more of a bunch of grapes rather than the coin stacking. And then we are seeing these mature RBCs. Then we are seeing the bluer, bigger reticulocyte, the immature ones as well. In this, so these are the mature, then the bluer, in this one, agglutination. What I'm trying to show you is this is the whole story right there. So this animal is anemic because how sparse. So when you look at the blood smear, you also estimate sort of RBC density as well, like how far they're spaced out. So if you see a lot of white space in the background in your viewing window of your blood smear, that means one, this animal is anemic. 2 is telling you why this animal is anemic, because agglutination, there's immune mediated response going on. So 3, this animal is anemic and bone marrow is trying to make up for that with the bluer reticulocytes. Okay, and here and there you will see maybe if spherocyte cells as well, to complete the picture of IMHA, immune mediated hemolytic anemia. And here are some leukocytes, neutrophils, and this is what we call band neutrophil, which just shows that again in the WBC side that this is there's an evidence of inflammation. The bone marrow is trying to push the immature of the white blood cells. So one, okay, so if you are if you know what you're looking for and you get to see spherocytes in an anemic animal, and then you know, there are some of the differentials you could think of. As I was, the example I was giving it to you was IMHA, immune mediated hemolytic anemia. Sometimes if you transfuse the blood, so for example, you know, if you know, you do the Coombs test and all that, and you know, with the matching, but still the transfusion, the other blood can be seen as a foreign, and then it can cause the hemolysis of the transfused RBCs, and then you can see that. Snake venom, zinc toxicity. I will show you an example of zinc toxicity later on. All right, so then a few of the other shapes you could see, I want you to see, pay attention. So again, in this photo are all red blood cells. So I don't know if you see the projections on this, like a lighter region on these red blood cells, and this is the inset here. So in the arrowheads, so you feel like you're seeing something and what we call these Heinz bodies, but sometimes they're very difficult to pick up on that. So Heinz bodies, I will show you one more addition to it, how to confirm it, and then we will see why these are made. Okay, so you know, Heinz body are very difficult to pick up upon. So what you can do is you can take a drop of blood, and then you can in that drop of blood you can mix a drop of new methylene blue stain. So new methylene blue will help you highlight these Heinz bodies, and then you incubate. When you mix a drop of blood and drop of methylene blue stain, you incubate for 15 minutes, then you take that a drop from that mixture, and then you again just your blood smear, you know, you just make a blood smear of that, of the new methylene blue stained. So then you make a smear. And then now when you look at, so this is your regular pinkish looking, the diff quick or right game sustain smear, and this is your new methylene. See, those are highlighted now, what we were seeing over here and there. So these are called Heinz bodies. These are also diagnostic, and then you see that when there's oxidative damage to the red blood cell. And some of the reasons that you can see that mechanism happening are onion toxicity, propylene glycol toxicity in cats. Other one common in here in the US is a zinc. I will show you an example. Then also in horses, after the winter, when the maple leaves, you know, they're dried and then they fall off the tree, they get to eat, and they can get red maple leaf toxicity of the dried red maple leaves, and so forth. And there are a few other examples that there are here and there reports that you can see Heinz body anemia. So my point is, one, you have to look at the blood smear. Two, if you make a diagnosis of Heinz body anemia, okay, I see Heinz body, okay, what's going on? And then you can go back to the history, why the patient is here, what happened recently. You can investigate from the owner and then see if you can connect what you see on the smear and what the history says, and then you can then move appropriately with the treatment options. Another one, very common, should not say common, but easy to diagnose, is the iron deficiency anemia. So remember that I showed you previously the mature red blood cells with the hollow hollow in there because of disc shape. I don't have a normal looking one, but see, they're more empty or more hollow in the middle because there's less hemoglobin, less iron. Hemoglobin needs iron, and because of the or deficiency of iron, you have less hemoglobin, and then that's why the less pinkishness because of that. So this is one anemia. You see more white spaces in the back. And then two, the RBCs are very empty looking, so the iron deficiency anemia. And there are characteristic features on the CBC data that matches what you look at as well. By the way, there's an eosinophil over here. So one of the WBC, what kind of WBC, eosinophil, and there's a neutrophil right there, and few platelets right here and there. Okay. Alpaca llamas, I wanted to show you for two reasons. One, well, this is an iron deficiency because they're more empty looking, but very a nice feature of these are that they are oval shaped RBCs rather than our rounder or disc shaped in our dogs and cats and cattle and horses. So that's kind of very nice feature for us to kind of have a fun fact out of it. So oval shaped RBCs in alpacas and llamas, and I'm going to show you goat in a second. But this is an example of iron deficiency anemia, that they are more empty looking with the very sparse with that tells us this animal is anemic. This is the goat I was talking about. They are also oval shaped, but very sparse looking, meaning anemia. And then there are different shapes to it, and we will talk about these shapes in a second. Okay. All right. Okay, so I guess we were going to talk about it. Okay. All right. So do you see these shapes where they are kind of tails coming off, like over here, over here, over here? So these are called schistocytes. So schistocytes, as I was going to show you in this photo. So this is our RBC, and then because of some sort of a damage to the RBC membrane, it kind of makes a bubble, and then it kind of comes off and makes tails out of it. It also could be because sometimes if there's so much inflammation and then there's so much fibrinogen, it shears off a part of the RBC membrane, and then you get these schistocytes shape. So when you see schistocytes, there are the few things that come to your mind that this must be going on in this animal. DIC is very common. DIC is disseminated inflammatory coagulation. Disseminatory intravascular coagulation, which is seen in very inflammatory disease conditions, or if there's a neoplastic condition going on. And then there's a hemangiosarcoma, and then some of the bone marrow conditions, and in cats, if there's hepatic lipidosis as well. So also, again, very diagnostic. If you see some shapes, you can think of some differentials and then go back and then do more history investigation and or other tests to get to the point of diagnosis or confirming the diagnosis. So in cats, we generally see different shapes. So when we talk about shapes, we call poik and cytosis, poikilocytosis. That means there are different shapes and so forth. And here's one sort of a schistocyte. There are few neutrophils. And then here is an eosinophil, and there is a fun fact about cat eosinophil, what I will show you in a second. So why I wanted to show you this photo, that if you have a blood smear from a cat, you put it in the microscope and you see all these weird kind of shapes, just don't go down the road of, oh, I see these schistocyte and all this stuff. Uh, Remember that cats generally have, a normal cat might have a different kind of shaped RBCs. That could be just a cat thing rather than a diagnostic feature of some sort. Okay. So these are some schistocyte, obviously, which you can pick out, but then you know what I was telling you was the different kind of shapes back there. That means nothing. It's just a cat thing. Neutrophil, and so one more shape I want to show you. So these are nice disc-shaped RBCs in the back, right? There's one reticulocyte, the one immature backstage of the RBC, and then there's a neutrophil, and then there are platelets over there, and then pay attention to this one. Okay, it's like a, it's like a RBC with the clubs, golf clubs coming out of this. This is called acanthocytes. There is another one over here as well. So acanthocytes are also diagnostic, that you could see in hemangiosarcoma, as well as DIC. So again, if you see, you have a list of differentials that can help you lead to what's going on in this animal, in that animal. Okay. Okay, so now we did the RBC shapes and what we can make out of it. There are many RBC parasites as well. So do you see this kind of a ring, what we call signet ring? It's like a ring with a diamond on the top. So there's a ring, and then this purple is the nucleus of the parasite, which is, you can just imagine the ring, signet ring. So this is a cat blood smear. So this is a Cytoxazone felis. This is parasite is seen mostly in the wild cats. So if this is a histo or of the normal lung, where there are alveoli, and then these are normal blood vessels compared to the normal, this is the cytox cat, where the blood vessels are filled with these parasite laden macrophages. So here is the blood vessel running through. Okay, and all of these are the macrophages eating those parasites. And then you can imagine the lung of that cat and how bad that cat must be breathing. But point is, having that blood smear and having those clinical signs, you can make, okay, this is I know what's going on. If this is a dog, then the similar signet rings are Babesia gibsoni. And these are different high magnification photos of the parasite. And remember one thing, these are not in the RBC, they are on the RBC, okay? I will show you photo in a second. So that was gibsoni. This is Babesia canis. These are pyriforms shaped. So one, you see a parasite, and two, based on the shape of the parasite, you can make a further diagnosis and so forth. Then this is mycoplasma. They're the dots, they line up on the parasites. And these animals are very anemic sometimes. And this is high magnification view of the another so mycoplasma hemocanis in a dog. And this is a mycoplasma in a cat, so mycoplasma haemophilus, but similar look of that on the RBCs. And look how anemic this cat is. There's like nobody in the back. The RBCs are so sparsed out. There is a reticulocyte and then nucleated red blood cells that bone marrow is trying to push to compensate with anemia, but it's not helping because these parasites are causing these so these parasites on the RBC are seen by the immune system as a foreign body, right? So the immune system is trying to attack the parasite, but doing so, it's also attacking the RBC, causing hemolytic anemia. In alpaca, again, another Mycoplasma haemophilus, but similar. Remember the oval-shaped RBC in alpacas or llamas, and then these are the dots over on the or Mycoplasma on the RBC, and this is the scanning electron micrograph of the RBC, and these are the Mycoplasma on the red blood cell, not in. Okay, so this is in the peg, similar as well. So although we are doing RBCs, but then there are some parasites you will see in the blood. So they are not in the cell, they're floating in the back. They are Trypanosoma cruzi, and these are trypanostigores, a stage of the trypanosoma. Then is the distemper inclusion. So if you have a puppy coming in, it's like very anemic, you know, and no vaccination history. And I think when I was back there, I have seen many cases, and then I have seen many cases here in here as well. So you stain it and use these big blobs of viral inclusion, distemper. Here you go, you have a diagnosis. And then if you have a cattle, and then Anaplasma marginal, I don't know which other species are out there. But you will see Anaplasma as well. And then you will know that why your cattle is anemic, you know, as you can see in the photo in the back. Okay, we are done with RBC. Obviously, there is way more I can tell you or talk about, you know, but then this was very high level that you could look at and then make a diagnosis. Moving on to the second cell type are the white blood cells. So now we will pay attention to all the nucleated cells. So red blood cells, we are done. So you can simply divide your white blood cells into granulocytes and agranulocytes. Okay, so what does that mean? Granule, meaning the cells have a granule, and agranule, meaning they don't have a granule. Very simple, right? So granulocytes are neutrophils, basophils. They have a basophilic granules, neutral meaning no color, neutral color granules. And then eosinophils, they have eosinophilic or pink granules. And cat also have obviously pink or eosin colored granules, but they're rod shaped. Remember I told you just a fun fact about cats? If you show me a picture and then show me a photo of the eosinophil, and then you ask me, can you tell me what species is it? I will look at the granules, I will say, yeah, it's a cat blood smear or a cat sample, okay? So okay, so now you know, so white blood cells, we also call them leukocytes, could be granulocytes with the granules, could be depending on the color of the granules. And then agranulocytes are lymphocytes. This is a lymphocyte, another one, and this is a monocyte, okay? Monocyte in the blood, but when they go in the tissue, they become macrophages, okay? All right, so this is the fun fact I was telling you. When we do the electron microscopy of the cat blood, these are the rod-shaped granules you could see in this eosinophil, and this is the nucleus of that eosinophil, and these are the other organelles in the back. All right, so now we can, okay, so we looked at RBC parasite, Mycoplasma, Babesia, and whatnot, right? Similar thing, you in the neutrophils, you can have intracytoplasmic parasites as well. And this one shows the morula or the stage of the anaplasma phagocytophyllum within the cell. So this is a neutrophil. This is the nucleus of the neutrophil, and these are the morula, parasite morula, neutrophil, nucleus of the neutrophil, and the parasite morula. This is the EM, nucleus of the neutrophil, and then this is the morula of the parasite. You can also see some other cells which you do not see normally in the blood are the mast cells. So mast cells, okay, when you can see when there's a lot of inflammation, that mast cells can appear in the blood. but also when there's a mastocytemia or mast cell neoplasm, you could see mast cells, and usually they are big cells. So when they get pushed to the feathered edge, so you could see there as well. And then in this photo, there are neutrophils over here, some monocytes over here as well. Okay. All right. So remember we estimated the leukocyte density. We said, okay, we can have a feel on the 20x, like how many there are. Obviously, you will have a numbers on the side, but also, so remember we said that. So I'm gonna ask you a question, so answer yourself. What do you think about leukocyte density in this one? Just to orient, these pink ones are the red blood cells, and these bluer ones are the leukocytes or the white blood cells we are talking about. Obviously, a type of white blood cell we are talking about. So too many, right? So this is a high magnification view. So these are the red blood cells, and these are the. So this animal has leukemia, and then normal lymphocyte count. So these are lymphoid cell. These are not neutrophil. I don't think I have a neutrophil in this photo. Yeah, I don't have it for the comparison. So these are, remember the agranulocyte, lymphocyte we had. So these are blastic looking cell. Why we are saying blast? Because the presence of the nucleus. Okay. So and one thing is, what is a neoplasm? It's a clonal production of a cell type. That's a neoplasm, right? So one cell is too many of the one kind, and you can see that we are seeing a similar kind of too many cells. That's it. That's what you want to know. If you don't know anything, you make a blood smear and you have too many of a same kind of cell, you know that there's a problem. There is a neoplasm. What kind of it? That's a different question, because your chemo or your treatment in general could depend on the type of neoplasm or leukemia, as a T cell, B cell, and whatnot. All right, so this is another kind of leukemia. Here, for a comparison, there is a neutrophil, another neutrophil. So neutrophil are segmented nucleus, and these are the neoplastic cells. Again, similar looking, and too many of them, too many. And then they have prominent what we call nucleolus in the nucleus. Over here, there's another one over here, and this is another kind. So as I said, first step is to identify they are scary looking, similar kind of too many cells, what they are, who they are, what the neoplasm is. It's a different question. You could do PCR, you can do PAR if it's a leukemia. For example, this one, it's very kind of convoluted nuclei. And then this one also. So one is a leukemia. What kind? Likely T cell leukemia, but obviously you need to do some special tests to make a diagnosis what kind of leukemia. To compare, this is a normal neutrophil. Another kind of, so see, I'm showing you different kind of leukemias. So I hope that you were able to pick up that the cells are of similar kind and there are too many. And then depending on how they look, so for example, in this one, in the cytoplasm, there are granules. This is a nucleus, and this is the one cell, and this is granules in the, so this is a large cell granular leukemia. So again, one is a neoplasm, two, yes, we can make more out of that. Okay, so leukocyte, one, density, inflammation, left shift, leukemia or parasite. There are different things you can look at. Next one, the third cell type is the platelet. Very quick one. I think I have like 2 or 3 photos. So remember, these are the red blood cells, platelets in the back, and then actually I have basophils in the background. So these are all basophils in this photo. Because of the basophilic granules, these are basophils. These are not neutrophils. Then we can also look at the giant. These are sometimes called giant platelets. Um, it could mean that if you have lower platelets and having more of the giant or mega platelets, that means again bone marrow is trying to spit out more platelets to make up for that those less platelet count. And I think, let's see, and this is obviously I showed you the platelet clumps, and that was it. There are a few more things you can do. If there are more of it, then it's a there is an inflammatory disease going on and so forth in there. Just very quickly, some of the example of the non-mammalian. So one of the fun fact of the bird, so this is a bird, that the red blood cells are nucleated, oval and nucleated. Okay, so a fun fact. Um, and then these are the lymphocytes. Again, too many in this bird. So as shown by this arrowhead. So this bird had hyperviscosity syndrome because of the too many cells, or the cell high cellularity of those neoplastic cells. Another thing you can do is that to find parasites. So these are the example of the leukocytosome parasites. Sometimes you just see these parasites, but then they do not impact or affect that animal like a background. Again, owl again has nucleated RBCs, which are oval shaped, very different from our usual species, dog, cats, cattle, horses, and so forth. And then also another kind of parasite is the hemoproteus. So these are intra-erythrocytic within the red blood cell, and they cup around the nucleus of the red blood cell. Again, they can be present just as a novel background, but not do any harm. Dheeraj, I have few cases to go, but I think we are running out of time. Would you rather go through the Q&A?
No, you can proceed.
Okay.
You can take up the thing.
Okay. Okay, so I think I'm gonna rush through it, but if you would like to slow it down, so let me know, guys. So this is a blood smear from a dog named Ashley. I do not know the age. And then, so okay, think all of you on the line. I'm gonna keep on talking, but you also think through the red blood cell, the leukocyte, and the platelet, and then at the end, what's going on? Okay. So see the sparseness. So obviously there is anemia going on. And then I see agglutination. Then I see, let's see, I see more bluer cells. So seems like there is some, there is a response to anemia. And I think I see more of the white blood cells. So maybe there is an increased WBC count. But obviously you would have the CBC or the hematology analysis numbers with you to confirm that. So again, we see agglutination. We see polychromasia, meaning the increased number of reticulocyte as a regenerative response. I am seeing a spherocytes as well, like over here, over here. And then I also see one of the neutrophil has phagocytose and RBC, which now changed to the hemosiderin, like a breakdown product of the RBC. Spherocyte, as I said, and then left. So I have the key down below. I don't know if you guys are paying attention or not. So when I say left shift, I don't think I spoke about that. So these are our mature neutrophils, or like we usually have. But these are a stage before the mature neutrophil that bone marrow is trying to push because of the increased need is the band neutrophil. So usually we do not, like if you take blood out of me or a normal dog or a cat, you would not see band neutrophils. But if we see more of these, that means there's a left shift of this, of these cells. And then you can see the inflammation is more responsive or left shifted, what we call. Again, there's the agglutination, bluer cells, and some of these cells, like this one, have what we call Howell Jolly body, meaning bone marrow is too fast pushing out the cells. And remember the last cell, the nucleus comes out, but it's just too fast, the process. Some of the nuclear fragments or the micronuclei are retained. Then we are seeing spherocytes. Then we have a nucleated red blood cell, a retained nucleus, again, as a heightened response from the bone marrow. And then I do not see any platelets. Okay. So this is, but there are few platelet clumps, obviously. So this was a case of IMHA. Remember the agglutination, anemia, bone marrow is trying to respond, and then because of the anemia and hypoxia, there is inflammation. So this is like a perfect recipe for you to diagnose this is IMHA. So Ashley had hematocrit or PCV of 15%. Usually dog has a PCV of 35, 40, or so forth. So obviously it's anemia. So this is your, this is just a part of your CBC handout, where you can, okay, now you're, okay, I see anemia on my blood smear. Okay, this animal is anemic. And then you try to put, okay, this is markedly anemic. And then there's a thrombocytopenic as well. Maybe the platelets are getting used up and so forth. Second case is a year-old Shih Tzu, had a 2-day history of lethargy, vomiting, diarrhea, and had orange color urine a night before the presentation to the clinic. Your blood smear, you can start making, okay, I see some sparse spaces, like white spaces in the back, thinking I am in the viewing window of the blood smear, right? Remember, not too far, not too in, okay? So, okay, so I think maybe there's a mild anemia going on, then increased number of nucleated cells, meaning the white blood cells in the back. Again, so we are going down like maybe 50x now. I don't remember this magnification. So mild anemia, increased number of nucleated cells. There are reticulocytes. There is a nucleated red blood cells over here as well. Okay. And then left shift because of this band neutrophil. Remember the inflammation. When I say NRBC, meaning nucleated RBC, the stage before you get to the mature RBC. Okay, so let's see which one is that. Okay, so I don't know if you see, do you see that projections? I told you that we can, that could indicate Heinz body, and you can do new methylene blue to confirm those. Well, we had additional piece of history in this dog. And so this is another photo. This is what we call ghost RBC. So remember, these are RBCs are dying. So in what we call this, just an impression of RBC, like little bit of hemoglobin present. So this is a ghost RBC with that Heinz body in there, and this is over here. So this dog, the X-ray, abdominal X-ray was done, and you radiolucent objects in the stomach. This is the esophagus, the trachea over here with the lungs, and then the heart, and so forth. And this is, they have the endotracheal tube in this dog. Head is on this side and the tail is on this side. Stomach having these structure, and then they did the endoscopy, are these coins. So in the US, these are pennies. And these pennies which were minted in mid 80s, 1980s or so, had zinc, about 98% of it. And then they just had a coat of copper. And then even if they eat few of the coins of these minted, what we call zinc minted pennies, then, you could end up zinc toxicity like in this dog, in this Shih Tzu. But you can also have zinc toxicity from, like, we have ointments or medicated ointment which have a lot of zinc oxide or zinc in there. So if they get if they get hands on those, they can end up with the zinc toxicity or so forth. So this was an example of hemolytic anemia in this dog because of zinc. Another one is a Paxton dog, 2 years old. You can see that slightly anemic because there is a lot of sparse spaces. Seems like fewer leukocytes in this dog. Anemia, decreased nucleated cells, and then I think that there are slightly more platelets. Okay, yep, increased platelets because they are in the back. So when I say I think, when I'm saying it's my subjective assessment, that I'm seeing more of these in a given field. Okay, and then I think that the hollowness is more than what I usually see in a mature RBC. So this is closest to a normal looking red blood cell, but then these one are more open or more empty, lack of a better word. So let's see. And then there is some bluer reticulocyte or the stage before the RBCs. So RBC, so when we could talk another time how to look at the data, a printout of the data of the CBC analysis. So this conversation is on the blood smear, but this is another whole thing that you can also make diagnosis out of the data as well. So when we look at the data on the CBC, complete blood chemistry, I've been saying CBC meaning complete blood chemistry. We also call it hematology as well. So you look at RBC, hemoglobin, and hematocrit together because they all go together. Hematocrit is a packed cell volume. How much of the RBCs you have, how much of the hemoglobin those red blood cells have, and how many RBCs you have. So you can tell that this animal has marked anemia, and these are the normal ranges for any given normal looking dog. So this is marked anemia, hematocrit of 12%. And then you would, so just to give you some idea, reticulocytes, remember those bluer cells for the regeneration? They are there to help anemia. Bone marrow is spitting out to help anemia. Usually, we have 1% or so, right? So you would say, okay, bone marrow is trying to act and behave and then trying to respond to anemia because we have 13%, right? But think about that. Anemia is so marked, although bone marrow is trying, it's not enough. Okay, so we will call this marked because of the degree of the anemia, and we will call non-regenerative anemia, although regenerative, but it's not enough for the degree of anemia this dog has. So we will call anemia marked, and then from this we will call non-regenerative anemia. Okay. Then the couple more numbers we look at is MCV and MCSC. I would not go in detail, but this is all about the size and how much hemoglobin those are red. So this is all about red blood cells, by the way. So it tells about the size of the cells and how much hemoglobin these cells have. So we call micro, meaning the small cells, and then hypo, meaning low hemoglobin. And this is the perfect recipe, along with increased platelets of 1,000, normal about 300,000-400,000, that this is a perfect recipe for us to call this is a iron deficiency anemia, which if you remember that we said that, one second, that these cells look very hollow with anemia. So this is iron deficiency anemia. So this confirms our data as well. So what we looked at the blood smear, our diagnosis numbers confirm as well, iron deficiency anemia. Trouble is the 8-month-old dog. Blood smear from this 8-month-old dog, there are some platelet clumps going on. And then within the leukocytes, you see some structures over here. These are yeast, histoplasma yeast. So see, even if you just run your blood from the machine is not going to tell you this dog has infection. Only you need to look at the blood smear to to make a diagnosis. So see how important this blood smear examination is. So this trouble had lower hematocrit along with hemoglobin and RBC concentration. So about moderate anemia, responsive 74, not responsive because usual reticulocyte. So now we're looking at the absolute number. The example before was the percent reticulocyte of your RBC. This is the absolute, so 74,000. Usually you have in a dog 50 or 60,000 reticulocytes. And then, so this is moderate non-regenerative anemia because this is not enough again for the amount or the severity of the anemia. And then this is normocytic, normochromic with inflammation, increase in the plasma protein. Sorry, I'm rushing through it. I guess we are towards the end of it. And then CBC will also tell you that this animal has inflammation because of the increase in neutrophil with the left shift. Remember, we talked about bands, and then monos and basos going up as well. And so it's the inflammatory leukogram with left shift. So there's anemia of inflammatory disease. So remember, this trouble had infection, histoplasma yeast infection, and because to respond to that, there's inflammation going on in this animal. I think this is the last one, or maybe not, maybe the second last case actually. So 6-year-old Bonnie, the dog. So Bonnie, as you can, as I said, don't pay attention to anything. If you can identify there's a more of the same kind, then these are the neoplastic cell. They're bigger, blastic, what we call blastic looking. Just to give you a perspective, this is a normal looking lymphocyte, small, mature, and how big these are. Okay, this is a leukemia in this animal, and this is an normal eosinophil, normal, I think I have this, eosinophil, normal, what we call small lymphocyte, and these are the neoplastic cells. So this dog has leukemia, and then these are different photos of the leukemia with the prominent blastic nucleoli. So this dog also had, so this is a blood smear, but also had enlarged lymph nodes and had lymphoma. So it's a leukemia lymphoma combination. So this is the last one, 5-year-old dog named Duke, had leukocytosis, meaning increased number of red blood cells. Seems like there's a mast cell right there. Obviously anemia because there's a sparse in the back, some nucleated red blood cells in there. Some stacking, coin stacking plus agglutination going on, band cells with the left shift. So there is one inflammation which is responsive, so left shifted, and then anemia, which is agglutination, and then let's see, and then so this is spherocytes. I think now you should be, pro in the IMHA. So this is an example of the immune-mediated hemolytic anemia with the spherocytosis, had marked anemia, 9% hematocrit, and so forth. And then, so when we have immune-mediated hemolytic anemia, usually macrocytic and hypochromic, and so forth. So we will not go in detail for that. Inflammation going on, 65,000 neutrophils, left shifted band, and usually IMHAs are very inflammatory. So this is classic for that. This is the last one, I promise. 7-year-old cat named Firecracker had so very few leukocytes in the back, and then few band neutrophils, so some inflammation going on. And these are the RBCs with the signet ring shaped parasites on them. This is the high mag view. And when on the edge, there was a huge RBC. So pay attention to the size of RBC, huge macrophage compared to the size of RBC. This is like 100 times bigger, with the large nucleus, nucleolus, and these are the stages of the cytosone, the ring shaped parasite we saw in the RBC. So this is another example in the lung of the same parasite. So this is cytozone. Remember I showed you the lung photo where these cells clog essentially the blood vessels. And then, so yep. So this is the spleen, and here is the blood vessel clogged up with those cells and so forth. And that is it. Thank you, guys. All right, I'm up for questions.
Thank you, Radna.
Yeah.
We'll take some questions quickly. Uh, One student has asked about prognosis of leukocytic leukemia in USA.
Yeah, so I think it all depends on the one. One is a leukemia, then they also do what we call PAR, that they do the arrangement that is a T cell, B cell, they try to classify it. It's a PCR for that. And once the oncologists identify it, then they offer the chemo. Like there is a CHOP protocol, combination of different things, and then it depends on how spread out that leukemia is. Do you have leukemia versus and lymphoma, like is it stage 5, that all the lymph nodes are involved as well. So prognosis is not like I cannot tell you, your dog will live
Mhm.
5 months or 5 years or whatever. It also is a constellation of what else is going on, and then how well your pet is going to tolerate the chemo. Because once you give chemo, like humans, right, you will end up having your chemo is going to impact your normal cell population as well, and then
Mhm.
how well you protect your patient from immune mediated conditions, like you cannot they would not have any neutrophils when they come back for the visit. So to give you a short answer, um, it depends on the type of leukemia,
Mhm.
how severely spread out that is, and then prognosis are different for T cell, B cell, or different kind of
Yes.
leukemia, and then depending on what protocol they follow as well. So not a simple answer. So yeah.
Yeah. Thank you. Another is a non-regenerative anemia, and it's important.
Non-regenerative anemia. Let's see. So is non. So can you say that again? The question is non-regenerative anemia.
Non-regenerative anemia. I think uh, he's just inquiring about this non-regenerative anemia, what it
So
is.
mhm. Okay. So think. I don't know. I'm not clear about the question, but let me say something. So for example, if I am anemic, right? So my bone marrow is trying to regenerate it. So that's response is needed. So the opposite of this is what you're asking is non-regenerative anemia, that I'm anemic from where the anemia is getting solved. Bone marrow has to try to push out to regenerate it. But if the anemia is non-regenerative, there are a few different things. I may have some very slow disease, or your pet has very slow disease cooking up, that that the anemia is very less severe, that bone marrow is not even recognizing it, or there's a problem in the bone marrow. Even if you're very anemic, bone marrow is not doing anything, not doing its job, so your problem is in the bone marrow. Or the anemia, the kind of anemia is that is iron deficiency anemia, then bone marrow is deficient in iron at the level of the bone marrow. Or that you have anemia, so like a blood loss anemia. So you bone marrow is trying to cope up to regenerate, but we are continuously losing
Mhm.
blood, or or it's a hemolytic anemia, that it continuously rupturing or hemolyzing the RBC, that bone marrow is not coping up, and you end up having a non-regenerative anemia. So it
Uh,
is actually
uh,
important to find a reason for the non-regenerative anemia. Yeah. Go
okay.
ahead, Suresh.
Ratna, one student, Mahak, she has asked something not related to this topic.
Yeah.
Uh, her first question is which country is better for practice?
Which country is what? Sorry.
Which country is better for practice for DVM?
Oh my goodness. Okay, so I think oh my God. Let's see.
Actually, you have
Yeah,
been to many countries now. That's why she has asked this
yeah,
question.
sure. I have, yeah, no problem. I have not practiced in Australia. So okay, in general, practice any veterinary medicine is good. I think the question is financially, I believe. I think the cost of it. First thing you need to know. So two things. I guess practice veterinary medicine in any country is good. You have to deal with the patients. You have to deal with owners. They are not going to change the both ends. Um, then let's see. Coming out of India, whichever country you go, Australia, New Zealand, Canada, America, you have to go through licensing exam. So that is the biggest step you need to conquer if you decide to move that way. Uh, Third question is financially. That could be okay. If I go, step one and two, financially rewarding. I guess at the end of the day, financially rewarding. I guess whichever country you um, choose, including India as well. Giving that perspective, it is financially rewarding itself as well. Um, at the end of the day, you just need to sit down and see, compare what the steps to get there. Which country has different and not. So yeah.
His question. One more question is there. DVM in Australia is same as that for Canada or USA?
No, so Australia and New Zealand, I believe back then had similar exams, because if you do Australia or the New Zealand, you can practice either country.
Mm.
Um, uh, but then Canada and US, they have CVMA. Canada has CVMA and America has AVMA. So I have both because I did the CPE. So I have both, so I can practice either country. So I would say Canada and America has same, but then eventually you end up doing the another license exam for the state you will practice. Like I have Florida license, so you do the another test for that. But the very first stage is NAVLI. So NAVLI you do, which if you are in Australia or any country, I think maybe India, I don't know. That is the first test you do for Canada or America. Um, yeah,
Okay. So this is all about the
yeah,
topic. So thank you, Aradhana. This was
yeah.
really a spellbound, practical oriented talk, which will surely benefit our budding veterinarians, students, practicing veterinarians. Uh, in this webinar, there were more than 250 attendees, and they were really attended this webinar throughout the this period, and hopefully they learn something out of this webinar. So I thank you once again on behalf of IDP GADVASU. You willingly accepted our request to deliver webinar. Uh, Actually, Monday is really a busy day, and you have a meeting right now after this talk. So thank you very much, and I thank all the participants from Kadvasu, other institutes, and field veterinarians and academic staffs from other part of the country. And our my sincere thanks are due to our worthy Vice Chancellor, Dr. Indrajit Singh, and PI of this scheme, Dean, College of Veterinary Science, Dr. Kumman, uh, and supporting staff of IDP cell. And last but not the least, my co-organizer, Dr. Raj Sukhveer Singh. I think he might be here. Dr. Raj Sukhveer, hello. I think he's not here. Uh, Dr. Raj Sukhveer
Hello,
Singh, Prof.
hello,
Uh,
hello. Yes.
Doctor.
Uh,
Yes.
uh, uh, Yes, I am really very, very thankful to Dr. Aradhana Gupta for sharing very wonderful and clinical oriented lecture. I really thankful Dr. Aradhana. So I would like to also share that Dr. Aradhana is uh, our class fellow. She is a 95 batch, and we spent wonderful days during our degree and then post graduation. So it's very nice to have with us our colleagues. They are giving back to their alma mater in uh, sharing their experiences from where they learn, from where they get their degrees, their roots with this university, Punjab Agriculture University, then Guru Dev Veterinary and Animal Sciences University. I'm really thankful to Dr. Radhana.
Thank you, Dr. Asukveer, and thank you once again, Aradhana.
Yep.
We'll touch in and we'll get some more topics, and we'll invite you for
Yes,
these kind
yes,
of webinars.
yes.
Okay, thank you.
We definitely we want such type of seminars that are helpful for our colleagues and especially our students. Yeah.
Okay, thank you.
Thank you all.
Oh,
Thanks
thank
for
you.
the opportunity. And then, I am really delighted to be here. As I said, regardless where we are today, we came from PAU, now GADVASU, so our roots are back there. And then we are here for anything you all need, like kids, students. If you have any questions, anything, what I want to say is that we chose this profession to help our patients, or dogs and cats, or cattle or horses who cannot speak. So I just wanted to show that a drop of blood can do wonders. And I hope that you were able to get something out of this lecture, and then at least you will attempt to make a blood smear, and then try to look into the microscope, and then but at the end of the day, all you can do is try your best, and then be there for your patients who cannot talk or speak or tell you what wrong that is. So you chose a wonderful profession, and I hope that you know that and you realize that. So yep. So thanks again for the opportunity, and thanks to Ras Sabir. Yes, my classmate, wonderful golden years we had together. So thanks all.
Thank you. Thank you.
All right, take care. Bye, guys. Bye.
Bye. Bye.